Thank you so much for joining. We're so excited to have you here. Share all the hearts, share all the love. We have Dr. Edgar in the room. I'm Dr. Wright. We are going to get started in just a moment, but go ahead and fill this room. Tell us who you are. Tell us your names. Tell us where you are tuning in from. If you're a general dentist, what brings you here? Just say hello and meet the team. We are going to get Dr. Kessler in the room, and then we will get started in just a moment. All right. I think Dr. Kessler is going to be coming in. We have 69 people. Go and share this live. Tell your friends that the ADA is live. The ADA leaders, yes, wave, say hello. We will try to say hello back. I'm Dr. Wright. Dr. Kessler is going to be joining in a second. We'll get him in here. We are so excited about this event. All right, so we have some hygiene students in the room. Dr. Edgar, we have people thanking you for your leadership. Dr. Kessler wasn't able to join just yet, but we're going to get him back in. You guys, y'all know how it is, technology, and we're all in different locations. So we've invited him again. Hello, hello, welcome in. Oh, I see a third panel. I see Dr. Kessler's joining. We are so excited. Hello, there he is.
We made it.
Can you hear us?
Yay, we did. Okay, so people are joining from all over. We have lots of people saying hello. They are waving at us, and it is our time to go ahead and make this happen. So thanks so much, everyone, for being here for our Ask Us Anything session today. I'm Dr. Arnell Wright. We are going to have an amazing discussion. And if you hear me shuffling papers, it's because I want to make sure that I hit all of my talking points. So today we're going to be featuring an Ask Us Anything session here live on Instagram with the ADA president, Dr. Linda Edgar, and our president-elect, Dr. Brett Kessler. As you've heard, my name is Dr. Arnell Wright. You may know me as the Daily Dentist. You may also know me as one of the co-hosts of the amazing Dental Soundbites podcast, also put on by the ADA. I'm a general dentist. I practice here in Orlando, Florida, and I'm going to be facilitating this discussion with the questions that you all have provided for our ADA leaders. A quick introduction really quickly about what we desire and some of our goals. At the ADA, we really want to hear the voices of our members in the dental community at large. And so this session today was designed to give you that platform to ask questions about the work that we are doing, the initiatives that we have, and any direction of dentistry as a whole. So whether you're curious about our latest projects, challenges facing dentistry, or the innovative ideas that are shaping our future as a profession, today you're going to hear from our ADA leaders that will address some of those things that have been on your mind. And so just a simple goal that we have today is really to support you by providing some answers and some insights to the questions that you have been waiting to ask. So I am so honored, without further ado, to go ahead and jump into this conversation. I'm so excited to be here with our ADA president, Dr. Linda Edgar, and our president-elect, Dr. Brett Kessler. So I'm going to give you both a moment to introduce yourselves and tell all of our attendees a little bit more about the amazing work that you do for the ADA.
Great. I'll go first. I'm Linda, the ADA president, and I'm so excited to be here. I've wanted to do this live broadcast for months now. One of my is this year to reach members and non-members with their questions and concerns. Both Brett and I have flown over 100,000 miles each this year, probably visiting states and schools and allied programs to see what's out there, to listen to you. Our goal, our mission at the ADA is to help all dentists succeed, no matter what the practice they're in, no matter what kind of group they're in, and we want to reach out and help everyone. We began in October. Some of our initiatives that we've accomplished this year, we began in October, merged with ADA, with Forsyth, which is a research institution. And this is going to allow us to increase our SEAL program, which has been great, but we don't have enough researchers to really meet the demand, and we're now going to be able to do that. That's very exciting. We've passed over 313 insurance laws and continue to invest in the dental loss ratio bills, with 3 states passing laws. We also helped Massachusetts a few years ago pass their Proposition 2 initiative. This wasn't by legislation, it was an initiative direct to the public, by giving them 5.5 million and then encouraging most states to contribute another 2.2 million. And we had one individual give over $100,000 to this cause. Mm-hmm. So we're here together. When we work together, we can get stuff done. Yeah. And these kinds of laws helps every dentist, no matter what modality you're in. There have been some questions about the sale of the ADA building and why that didn't go to the House of Delegates. Actually, part of the board's duties and role is to be involved in the sale of any buildings and maintenance of any buildings that we own. This is something that the board is responsible for. Mm-hmm. We had a task force that has been working on this for a couple of years. We got a great price, and we're going to be able to pay for our lease with the interest that comes out of the proceeds that we got from that sale. So thank you for that question that came up last night. We also have sold one of the buildings in Washington, D.C., and this sale is going to go towards seed money for the new credit union that we are developing right now. This will be developed by ADA only, no partners, just for ADA members. And this is one of the value propositions we've increased. Thanks to donors, very generous donors, we have collected enough money to purchase over 20,000 lessons in a lunchbox. Mm-hmm. And you can go to the Children's Oral Health Institute website to find out how to help 2nd and 3rd graders get brushing back into the schools. Mm-hmm. We're moving very, very quickly on developing our Salesforce and Fontiva platforms. Mm-hmm. This is going to enable us to really hype up our ADA app, which we'll be able to use artificial intelligence to meet your needs in a customized way. We're so excited about our involvement in DC. This was another question that has come up to me. Why aren't we in DC in person? And we actually are. We actually had 1,200 people in DC and meeting with legislators. 700 of those were our amazing dental students from 55 different schools. We're so excited about that. And Brett, next year you're going to have even more, I'm sure. We also have developed a task force on lowering dental school tuition, which is ongoing. We know that part of our membership challenge is that we have, our new dentists have a lot of debt, and it's difficult for them to write a big check. So we're working on that end. And we're also working on a pilot program for a new membership model, which we're hoping will help reduce the fee to get in. So I'm going to stop there. We need to communicate, collaborate, and connect. Those are my 3 platforms. And I'm going to pitch it over to Brett to give his intro.
Geez, Linda, you left me nothing to talk about. Typical Linda. First, I want to say hi to everyone. I've been watching the names roll through. I have so many friends and supporters, and a lot of people I don't know, and it's great that you're here. And thank you for your interest in what we're doing at the ADA level. My name is Brett Kessler. I'm a general dentist, practice in Denver, Colorado. I president of now, and someone was calling me on my phone. I'm very excited to to be in this role and support the ADA and support Linda. Currently, I am in Rhode Island, and this morning I was in Boston visiting the Forsyth Institute and talking about some things that we'll be doing that will directly affect positively the future of dentistry, with some of the research that we're doing. We're looking at new materials, we're looking at new techniques, we're looking at new ways to outreach to get access for those that have no access. And it's really an amazing opportunity that we've merged with the Forsyth Institute. And so from there, I drove to Rhode Island to meet with Rhode Island's Attorney General. And in Providence, it's they have very, very low dental reimbursements for Medicaid. And so we're just strategizing with the Attorney General on how we can get several 100,000 kids that have zero access because there's no Medicaid providers here. And so this is the kind of work that we get to do on a regular basis. And it's really I feel like the impact that I hope to make, we're making. And the team at the ADA is working our butts off to make sure that not only that our members are ensured success, but that the communities we serve, their overall health is improved in big ways. So
I love that. Well, thank you both so much for taking time and meeting with our community. Why don't we go ahead and jump into our chat today? A couple of housekeeping rules before we start with our Q&A session. So just to remind everyone and to share that we polled our followers for questions last week. So we are going to be addressing those questions today. Please note that this is not just a panel discussion as usual. This is an opportunity for us to engage with you, or for our leaders of the ADA to engage with you. So with that in mind, we are encouraging active participation. We want you to ask those questions, drop them in the comment section, drop them in the question box below. And we have an entire team that's behind the scenes that will be dropping questions here for us to ask live after we go through a few of our most important, or like the top 4 questions that we received from our community. One last thing, we do want to advise you all that this is not a discussion on dental or medical advice, so we will not be answering any of those questions. But without further ado, why don't we dive into our discussion? Are we ready, team? Dun, dun, dun. Woohoo! Okay, so our first question for everyone here, for you, Dr. Edgar, we'll start with you, is how can we best know about all of the benefits of being part of the ADA?
Well, great. Thanks for that question. And I've really been trying to answer that question for the last 2 years as we've gone around to different states. So answering the question, what has ADA done for me lately? Some of the things we've, obviously what we're doing today, we're trying to reach out to members and non-members. Both Brett and I give out our email and our telephone number, which you will get at the end of this, to send us any questions or responses that you have. We have presence on several social media sites, hopefully that will reach our newer dentists that really need to know, what we're doing. Some of the things that ADA does that you may not be aware of is that all the products you use in your dental office daily are tested for standards by the ADA. And this helps all dentists. We have a call center that people can call in with your member needs. We get thousands of calls from members every year. We spend about $2.7 million a year, and we invest this money with states to help with insurance legislation. There's some sites that have a lot of information on them. I'm going to quote right now. If you want to know anything about ADA, it's ada.org / and what you want to know about. So ada.org / advocacy has lists of all the things we've been doing. ada.org / dir has lists of and maps showing the legislation we've accomplished in different states. ada.org / wellness, which Brett may go into later, has a lot of our wellness ambassador program, things like that. We're doing AI research to help you become more efficient with practice management. And we offer over 300 CE courses under the ada.org / CE website. The other thing we often don't bring up is what ADA has stopped from happening. We don't have a lot, and I'm going to give you a couple of the things. One is we have stopped attacks on medical devices. We stopped attacks on aesthetic procedures. We stopped fire protection standard, which requested practices to retrofit gas lines. This will save a practice $50,000. None of these things are talked about, but you need to know that ADA is there to protect your interests. We've prevented student loan interest deduction from being eliminated. And one of the things we were advocating for in DC with our 1,200 people was to prevent interest from being accumulated while dentists are in their dental school period or in residency programs.
Mm-hmm.
We do guidelines, we protect your license. We have been successful this year getting 9 states on the compact, which will allow states, dentists to move from state to state, and hygienists.
Mm-hmm.
We developed an OSCE exam, which is a non-patient exam and has been tested. And I guess for me, one of the things that's most important that I haven't mentioned is there's nothing that can replace the one-on-one connection that you make at your local level talking about ADA. People are concerned that our market share is dropping, and we need to get out there and tell people how much ADA protects you in your profession. And I'll throw this over to Brett.
Yeah, and I'll kind of play off what you just said about membership. I believe that membership begins and ends at the street corner level, at the local
Mm-hmm.
level. We at the ADA can do all sorts of things from our headquarters in Chicago. But I joined. My first boss told me, if we are to remain a profession, everybody has to contribute in some way. At very least, you need to be a member of the ADA, and I feel so strongly about that. I'm going to pay for your membership as a benefit of working for me. And we are remodeling our membership model with how we work with the tripartite at the national level, and we'll be doing some pilot programs about that. I'm sure we'll have some questions about that later. But membership is so key right now. So many changes are happening in healthcare. So many changes are happening in dental care. We need to have a unified voice because we are the most influential lever in dentistry. And if we're fragmented, we will not get anything done.
Yes. What a great way to transition into our next question that you're going to answer, Dr. Well, our connection just ended. We can't let that happen. Go ahead and fill back up in the room. Let's get our leaders back on this live event. So the next question is, what are the main things that dental students need to do to transition to professional life after graduation?
Well, one of the things that I think is really important is to get a mentor. And that's one of the things we do with your ADA app that we're improving every month. We have mentors that are very interested. One of my initiatives this year actually is to encourage people like me who are at the end of their career to be available for people that want, to have a connection.
Okay.
The other thing we do, Brett, I'm going ahead and just answering question 3, and then you can go through the question 2. The other thing, again, on our website, we have a lot of information for students. ada.org/wellness has got a lot of the information. We have an ambassador program. As students, sometimes you have tough days, and we want you to know that you can reach out and, connect with any of us. Getting involved in a study club after you graduate, especially a study club of ADA members, you will have friends for life if you do that. I know I do. And you can share, without worrying about what people think about you, your failures in your office. That's one of the most important things. Other things just a few other things that ADA provides. We have the dental sound bites, which Arnell is very familiar with. The New Dentist Week Huddle. We have, again, the Wellness Ambassadors. We have career services, ada.org/careers. And we have 300 CE courses that you can take online to help with your licensure requirements. So I'm going to go ahead and throw it back to you, Brett.
All right.
Okay.
So one of the things that I was going to start to say was when we think about work, we think about insurance. So can you please tell everybody what the ADA is doing about stagnant insurance reimbursement rates?
Sure. First of all, can you hear me?
Yes,
Yes.
we
Okay,
can hear
good.
you.
I'm
Perfect.
having all sorts of technological issues here, so I apologize. Yeah,
No problem.
insurance is top of mind on every practicing dentist's 20 every hour of every day they're seeing patients. And it's so important. And we've been working like crazy for decades to try and, make it better and even the playing field. And one of the things we're most proud of is what happened in Massachusetts this last year or 2 years ago with the DLR bill, question two, and we're trying to recreate a model similar across the country, so we can hold dental insurance companies accountable for paying out dental benefits that are reasonable compared to the amount of premiums they're collecting, and it's really important. We have an ongoing lawsuit with Delta Dental right now, class action lawsuits in all 50 states, and to try and again even the playing field and make it better, that we can all play in the sandbox. 95% of dentists do take insurance. We have to make it better. We've had issues over the years that less than 6% of people with dental benefits ever reach their maximum on any given year. And that's a big concern. We get questions all the time. Well, they haven't raised their maximum since 1972, but there's no reason for them to. And so we're working really hard to make it easier for patients to actually utilize the benefits that are afforded to them, either through self-pay or through their employers. One of the most exciting things that we have going right now is we filed an amicus brief with the Supreme Court around ERISA reform. We've got all these states. So every state has a legislation and rules that the dental insurance companies can abide by. ERISA is federally administered, so they've been bypassing the state laws that we've been working so hard to create. And and the Supreme Court a few years ago did rule in favor that the state laws do prevail, but then there were some lower courts that disagreed with that and had a different judgment. And so we're asking the Supreme Court to enforce what they enforced several years ago, that the ERISA plans cannot usurp the state laws. So it's really exciting about that. So that's the private access or private dental benefit, landscape. We're seeing some major changes and shifts in the public access. Last year, the CMS asked all oral health entities if we were to, expand or, clarify the definition of what is medically necessary. And so we made some opinions on that. And the Medicare space, we were able to improve and enhance what dentists get paid for in the Medicare space for things like cardiothoracic surgeries around endocarditis involved valves, cardiac valves, removing teeth before radiation and things like that. So we're finally getting benefits in that realm. And then we're strengthening our Medicaid program in big ways. And several states have had huge wins as far as getting reimbursement levels to a level that sometimes are actually higher than the private pay dental benefits, where Medicaid is the best payer in the state. And so we're going back to the dental insurance plans and saying, hey, can you're not even covering Medicaid fees, you need to raise your fees. And so we're getting great traction in that. And the communities are their overall health is improving as a result. So we're working like crazy, and it's a tough nut to crack, but our efforts are 100% pedal to the metal.
Absolutely. Well, we are so grateful and thankful for all of the things that you and the team are doing for our profession. So the other question that we have for you, Dr. Kessler, and of course, Dr. Edgar, please feel free to weigh in. What are the ADA's current efforts to support whole body health in dentistry and with our colleagues in medicine? This is a big one. I know a lot of people are interested in this.
Yeah, this is one of the big points in my year as president, is to really reconnect the mouth to the body.
Yeah.
It's time. Oral health is health. You'll hear me say that a lot. Oral health is health. we know it's connected. And so the benefit programs have disconnected the body from the mouth, and we need to reconnect that. And so, there's tons of research going on right now. It's not fringe research anymore. It's compelling and it's abundant that, that if we can improve the oral health of our patients, we can lower the chances of them having long-term chronic diseases, and they can better manage many of the chronic diseases that they may have at the time. We're really excited about that. And so, in fact, we had a symposium last 2 weeks ago, I guess, in Chicago, where we discussed all sorts of things that that medicine and dentistry can do together. 20 or less than 10% of the people go to their physicians for proactive health. Wow. Okay. Most of our patients come to us for proactive health. They come for their regular checkups, cleanings, and x-rays. That's proactive health. And so we've got this opportunity to discuss health proactively. Most people go to their physicians when something's wrong. It's not health care, it's sick care. And so we've got this opportunity to create conversations about diabetes, about mental illness, about cardiovascular disease, and how our microbiome, our oral microbiome, all these things that will help improve overall health. And we can get them interested and possibly even into the hands of their physicians to deal with things like that. And in addition to sleep apnea is a big one. So, we're doing all sorts of things in that realm. It's exciting.
And I
love it.
I just wanted to throw in a couple other things on this. We are constantly meeting with allied groups, the disability group we're meeting with to help, on that area. We're meeting with the specialty groups, AAE, the Academy of Orofacial Pain, to get their message out and collaborate with them, for news articles and things that actually go out to the public about overall health and what you can do.
Yeah, we have a sugar task force where we're actually looking at, we know as dentists, sugar causes cavities, but it creates all sorts of health issues too. And diabetes is running rampant in different demographics across the spectrum in America and across the world. And it's pretty much, caused by the food industry. And so we have, again, this opportunity to help our patients make better choices with their diet. And this sugar task force is our entry into that. So I have to thank George Shepley, past president of the ADA, for bringing this forward, and we're continuing it forward through my year as well.
Yeah, I feel very strongly about this, and obviously with my initiative to try to get into the schools, what you teach in the schools gets home to the parents. And I get into the schools with sugar education. And one person sent me a question and said that ADA is no longer looked at as the go-to organization, and I sort of have a question mark on my mind. We get called all the time for responses to news articles and collaborative opportunities, so I'm not sure why they felt that way. Maybe we can do better. We can always do better, and that's through collaborations, because we are a lot stronger when we all work together.
While we're on the topic of collaboration, I did just see a question come through, and if I may, I would love to talk about this. And then also, Dr. Kessler, I would like to go back because I saw one question that came through the chat that was germane to the topic of health in dentistry. And so on the topic of collaborations, one question says, what can the ADA do to increase and maintain dental faculty participation? I know that we have had some efforts around that, so I think this would be a great opportunity for us to expound upon that for one of our attendees.
You want me to take that one, Linda?
Sure, you can, and I'll fill in.
Okay.
Else.
So first of all, I mentioned before, we're revamping our membership model, and we know we've built aspects of dentistry. In fact, one of them significantly the actual membership to across the board, and I think that'll especially.
Dr. Kessler, can you hear me?
Yeah.
Sorry,
I can hear you. Can you hear me?
Yeah, we had a few pieces of, it just was a little spotty. So I'm gonna have you start from the beginning so that we can catch the whole entire context of your statement.
Sure. Sorry about that. Again,
No, you're
technology is
fine.
great when it works.
It's okay.
Uh, so as I mentioned before, we're revamping our membership model, and we've priced ourselves out of the desire for membership in many different demographics, and and especially in faculty where they don't make as much money as a private practicing dentist, and so we want to lower the dues so they would see the value and become members. We're also looking at loan repayment programs for faculty. We want to expand that in big ways. We know that faculty are the biggest influencers of the dental students, and the dental profession, the ADA, the tripartite, the different states and locals support the dental schools in so many big ways, and we know that our future is dependent upon that our message gets carried through, and the best way it gets carried through is through the faculty.
Yeah.
So we really want to do our best to support them in our own interest.
Fill in a couple things.
Yeah.
Dr. Ray Comia has visited, is one of his goals as a former dean is to visit all the dental schools and to get their feedback, what can help them. We also have a faculty ambassador program that one of our trustees came up with, which is where the faculty is connected to the students. And we're hoping to be a lot more consistent getting into the dental schools. I know Brett and I have both been invited to many, many schools this year. We've gone to district meetings and talked to the dental schools and the faculty about, what ADA does. I mean, it's a big secret,
Yeah.
so we have to get, our value up there. And we are, and that's another thing, I've had those questions, what are you doing about increasing value? And one of the things is this credit union that we're developing, which is just for members, which will allow any person, any member to get loans at a much more reasonable rate through an ADA only program. So.
Yeah. I'd like to expand on the credit union conversation a little bit if I could, because what we're hoping to do with that is that we will be able to offer financial services for every season of a dentist's career. So we're looking to offer student loans. We're looking to offer student loan repayment programs or refinements, and we're looking to offer practice loans, house loans, car loans, so anything you could do, patient financing, anything that a dentist, financial service that a dentist would need, we're going to be offering that. And it will be wholly owned by the ADA. There will be no outside interests that could, jeopardize its future as a credit union. And it will be only for members, and we'll be able to offer rates at that are way more competitive than banks. And because we know the dental industry, we should be able to provide the best possible financial services for our people. So it's really exciting.
Yes, that's so exciting. Such good news. I know everybody is. Oh, go ahead. Yes, Dr. Edgar, please.
And we talked about the students is we do have a equitable financial advisor, which is offered for student members. And I didn't really emphasize, if you're an ASDA member, you're an ADA member, and we do a free membership for the first 18 months. If you're a non-member on this call and you want to join, here's my advertisement, go to ada.org/membership application, and a membership application will pop up. And if somebody has promoted you to become a member, fill in their name under the sponsorship line, because we do have prizes right now for people that recruit members. I had to throw that in.
Yeah, no, that's totally important. Well, actually, while we're still talking about support, so we've mentioned, our students, and we've mentioned our dentists and the profession. There's another group that I would love to talk about, Dr. Edgar. Could you share a little bit about ADA support for our veterans? We would love for you to expand on this topic, if you will, please.
Yes, well, I'm very exciting. Having grown up as a child of a Coast Guard rescue pilot, My dad was actually ended up as a 2-star admiral. My uncle was a 3-star general who was in artillery. My whole family has come up through the military. My husband, who's a dentist, retired as a colonel and went to Desert Storm when I was in my third dentistry of dental school. So we are actually, we have a Give Veterans a Smile group, which is very active. Dr. Mark Vitale from New Jersey is doing amazing things. We have several trustees and other people on this. We're going to actually at SmileCon have a big promotion for veterans this year with a gala and donations to help veterans get the dental care that they need. And we're moving this, you know, as large as we can get it.
Beautiful. Oh, well, thank you so much for that. And Dr. Kessler, would you like to weigh in?
On veterans?
Yeah. I didn't know if you had anything to add. I didn't know if you were going to say anything, but
Yeah,
if
the
not,
only thing I would add, you know, Linda's always so complete.
I
I
know.
have very little to say, but you know, we partner with the Dental Lifeline Network,
Yeah.
and I'm on their national board. And Dental Lifeline Network has a very, very strong, endearing feeling to help the veterans. And so through DLN, we should be able to coordinate not only through our Give Veterans a Smile, where it's a single off event, we'll be able to, you know, care for them throughout the year as well. So very exciting. And again, collaborating with the different organizations that are out there is really awesome. And we can do so much more together than we can apart.
Yes, 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 yes.
Well, I will give a shout out to Teresa Chang, who won our humanitarian award. And she has Everyone for Veterans. We have several groups like this that we're working with collaboratively and trying to help with their needs.
Yeah.
Shout out to our humanitarian winner, Dr. Chang. So I do have another question that did come up in the chat. And for our social team, if you could go ahead and start putting some of those questions here in the chat so that I can ask our panelists those questions before we close, that would be great. One question that came up a little bit earlier in our discussion today was about foreign trained or international dentists being members of the ADA. I did see that, and I did want to circle back to that because I know that that has been a topic of discussion. And then on the topic of mentorship from the ADA. And so either one of you can take that question.
Okay, I'll jump in on the advanced. Are you talking about advanced standing students or
So
foreign dentists becoming? Okay.
Yes, both. If you can talk about it both, because the question came up in multiple comments, actually.
Yes. Okay.
Okay, so we have many dentists who train overseas in different countries and come here, and in order to get licensed there, they have to go through the advanced standing program. And you know, and it's important to be able to demonstrate competence and the knowledge, you know, clinical competence as well as clinical knowledge and judgment, you know, that are the standards here. And many of these advanced standing students are very highly accomplished in the countries they're from, and it's amazing when I get to hear their stories. You know, people come to America to practice dentistry. Some are coming because they're seeking a brighter future. Some are running from, you know, political persecution, and you know, it's very very touching, some of the stories that I've heard over the years. In fact, there was a story in the Washington Post after we pulled out of Afghanistan when President Biden took over. You know, there was a mass exodus out of Afghanistan. There was a dentist who, you know, trained in Afghanistan, practiced in Afghanistan, and when, you know, we were pulling out, he was afraid the Taliban was going to utilize his intellect for, you know, part of their, you know, their goals, which is not good. And so he wanted to come to America so badly. He was one of the ones that tried to get out of the country, and he hid in a wheel well of the airplane, and he perished. That's how badly people want to come to America, and how much I respect the courageous, you know, people that have, you know, uprooted their lives to come here and be able to contribute to the dental profession and communities in big ways. So it's I guess one of those subjects that really touch my heart. And I mentor several advanced standing students who are now dentists, and they're awesome people, and they're awesome practitioners. So very excited for that demographic to be included in ADA membership. I don't know if there is an ADA membership for foreign dentists. I think there is some sort of affiliate membership, but I guess we can, get back to whoever that is. I don't know offhand.
I will throw in, I actually was very privileged to be invited to speak to the African Student Dental Association earlier this year. There were over 100 people on that Zoom call. Oh, wow. And these were some of the questions they were asking, do we have to go the 2 years? I know that we are looking into, with CDEL, the Council on Education and Lecture, on possibly creating tests that test. This is, a ways down the road, but, it's an option. Also possibly looking into allowing the advanced standing foreign trained dentists to get a hygiene license so they can possibly practice hygiene and help with their expenses. I mean, I got so many great emails back from this group. They're so passionate and so smart, and really create a great addition. I know Brett just went, Brett and I both done the white coat for Boston College.
Yeah.
And there's like, 100? There were 100 across the states. They're all taller than me.
That's not saying much, Linda.
Getting shorter by the day, too. Pretty soon I'll be out of the frame.
Goodness. Okay, so we did have another question that came through. It says, I'm sorry?
You mentioned mentorship also?
Yes, if you could.
Yeah. Well,
the next question takes that into consideration as well.
Oh, okay.
Actually.
Well, you can go ahead and maybe we can merge the answer then.
Yeah. So how can dental students get involved and be mentored with advocacy within the ADA?
With advocacy. Mm-hmm. Well, one of the ways is to come to Lobby Day every year. We actually help fund students. We funded their hotel rooms this year, up to 3 in a room. And I think that really helped with the expenses to come. There's nothing like shadowing. And actually, we end up shadowing the students because the legislators really want to hear from students more than us. Mm-hmm. That's one of the ways of getting involved with advocacy. I think people see how important it is to be one-on-one with the legislators.
And so, with that initiative, we invited 12 students from every single school across the country. And, for years, we've been talking about how great and important the ADA is, but we decided, well, let's include them in the process so they can experience it themselves. And, I have not heard one single negative from that experience from any student across the country. It was absolutely amazing. And we're looking to increase our footprint next year. And so there were some schools that weren't able to send any students at the time, for whatever reason, and whatever's going on with their school, and they couldn't do it. So we have extra slots. So if I know we're going to increase it next year, but if you want more people to come, we're going to find ways to get those people there. So it's very important. But in addition, the states have their own advocacy agendas as well. And, I'm from Colorado. I know we include the dental students in our lobby day in Colorado, and they come in droves, and they're so important in the conversation because, as Linda said, most of the legislators and legislative aides, they don't want to hear from us. They want to hear from the students because they know they're the future. So it's really it's unlimited as far as opportunities for advocacy. Get involved in ASDA. Get involved in your legislative committees at ASDA, and we're there to support you and help you and include you at the ADA.
Dr. Edgar, you were going to say?
Yeah, the other thing we did this year was we invited all of the specialty groups and allied groups to come lobby day, and I think almost everyone had some kind of representative if it wasn't their president or the governance person. And this is a great place for students to connect with specialty mentorship and how to.
Absolutely.
So we have another question, and it's related to the Foresight Institute. This question says, I am interested. I'm sorry. The attendee here says, I'm interested in the recent ADA partnership with the Foresight Institute. What does this mean for member dentists?
So can I answer that, Linda? Is that okay?
Here, I'll fill
So,
in.
so first of all, evidence-based science is one of our core values. And we had research going on within the ADA for decades through the Paffenberger, Institute and the ADA Science and Research Institute. And we were looking to provide clinically relevant research that goes from, lab bench to clinicians' hands into patients' mouths. Okay. And so as we were growing the Science and Research Institute, the opportunity came up to merge with the Forsyth Institute. Forsyth Institute is world renowned, has a global presence, not only within America, but across the world. And so now we have this opportunity to collaborate in big ways with universities, postdocs, and I think we're number 2 or 3 in grant recipients from NIH in the country. So we are the biggest dental organization in the world, merged with the biggest dental research organization in the world to create a powerhouse. Okay, from the public standpoint, we have the ADA seal of acceptance, where we, rigorously test, products like toothpaste, floss, toothbrushes, and things like that for the public to know that if it goes through the ADA seal, it is worthy of using, and it is what it says it is. And so if it has a seal, that's an important thing, and it was very coveted by the industry to get that ADA seal for the public consumption. And we didn't have the capacity to research everything and based on the demand. With the Foresight Institute, we can now expand that and get caught up with trying to offer more and more ADA endorsed seals. In addition, we'll be looking at another thing with the public is they are really all about access, improving access to care. And so they've got all sorts of models, and especially in the Northeast where I am right now, where they are improving the lives of our patients and the communities that have no access, and they're doing really good stuff with that. What else? I'm drawing a blank. Anything, Linda?
Yeah, I just want to emphasize,
okay.
We went from 2 million in grants to 30 million in grants as a former budget and finance chair, I want you to know we've been very frugal in that we're not spending any more having merged with Forsyth. We're helping with the admin costs. And that was the beauty of coming together with this collaboration. It is so exciting. Brett and I have been out there a couple times. He was out there just the last couple of days, and I feel sweet about leaving because it's going to explode. I had one person send me a note saying, because I mentioned we were expanding the SEAL program, and they said, well, what about helping our dentists in our country? Well, expanding the SEAL program is going to expand our non-dues revenue big time. That's going to allow us to decrease the dues. One of our big goals is to decrease the dues and make it more manageable for our younger dentists to join.
And also, Linda, we just got a grant that put us over $40 million in funding from NIH. I learned that today, and it will be to provide, we're trying to find an amalgam substitute that is easy to use, easy to administer. Composite is great, but composite works best under the guise of a rubber dam. And sometimes you can't do that in different parts of the world. And so it's we're looking at that. We have all sorts of intellectual property that came with the Forsyth Institute that is very attractive to the dental industry. And so we have a meeting every year called Dentech, where it's almost like investors come in and they see the research, they see the clinical products that we're researching, and they bring them in and they start companies based out of that. And so we have all sorts of things happening that literally go from from lab bench to clinicians' hands into mouths. And it's pushing the profession forward, and we're driving that narrative. If you think about, I've been in practice now for 29 years. The practice of dentistry has changed immensely. We were talking about this morning about how I started. There were dip tanks for for our X-rays. We had to dip them in, you know, and Fixer and, you know, and Developer and, you know, and now that's, you know, everything is digital. We have digital printing, we have digital milling, we have digital scanning, AI, all sorts of things that we are driving the narrative for while we're creating standards on the other part of the ADA to make sure that is, you know, the best in class and it's doing what it says it's doing.
Thank you all so much for that. So I was just dropping a little message and a reminder for everyone to share those questions in the chat. We have a little bit more time, and I did want to return back to this one question. How is the ADA embracing new technology?
Well, we're studying obviously AI through our institute. We're setting up guidelines so that the dentists know what they're getting if they're investing in AI in their practices. AI can really help with the workforce issue because it can make your practice more efficient if you use it right. Just what Brett was talking about, you know, we're working with, there's all kinds of new products that are coming out every month. And we test those to be sure you and your patients are safe. And that's one of the things that's one of the best kept secrets. And yes, it helps all dentists, whether you're a member or not. But if dentists don't join, we won't have the money to continue to do this. So go ahead, Brett.
Yeah. And technology is exploding. Yeah, if you want to talk about AI, Wall Street is investing in AI at the same level that they were investing in this internet thing 30 years ago. Okay, they see AI as the next frontier in everything we do. And if you don't think you're using it right now, if you have a cell phone, AI is entrenched in your life.
Yeah.
And so bringing it to dentistry is going to be amazing. As I mentioned before, digital scanning, digital printing, milling, you know, it's going to be amazing. You know, there's robotic implant placements going on right now. I got to see that in Boston University the other day. It's unbelievable, the practice of dentistry, how it's going to be, you know, so, you know, with this digital printing and digital milling, there's a big shortage of lab techs in the industry. And so we need to find ways to leverage, you know, technology to fill that void.
Yeah.
Because that could be really significant as far as, you know, being able to deliver quality care to our patients.
I'll add just one other thing we have already in place is an innovation advisory committee, which is made up of entrepreneurs with expertise, new companies, new programs. We allot $1 million a year for investments. We've invested in salivary diagnostics, which is going to be huge, I think, to help prevent and, you know, get people on the front end of having problems. And AI, we've invested in that, and they are in there. They've been successful at, you know, looking at new companies, and this will help in our non-dues revenue also.
Love it. Love it. Okay, so we have one more question that we're going to end with, and I'm going to give some closing remarks and some reminders to our attendees. So stay until the end, everybody. The last one that we're going to finish this chat with is tell us about any future casting. So where do you all see dentistry in the next 5 to 10 years?
Okay, I'll start. I'll actually start with AI.
Yeah.
Okay, and so I view, yeah, right now AI is really growing in the digital radiograph niche of dentistry, part of our practices. But I see AI as being, you know, the most amazing assistant that you can possibly have. I'll have an earpiece in my ear, and you know, the AI computer will tell me before I enter a room, Mrs. Jones has 3 kids, you know, ages 12, 8, and 4. They went to Disney last year. You did a filling on number 12 and 13. She had some sensitivity with that filling. She came back for an adjustment. Please ask her, you know, how it's doing. You know, and as I'm walking in, that'll all be fed to me. And so I can be talking to my patient immediately. And, you know, those are the kind of things I put in my dental record, but I'd have to go search that dental record before I went in.
Right.
So this will be automatic. In the meantime, it would be paying attention to the conversation I'm having with the patient in real time and writing up a note for me with all the things that I want to be highlighted for that patient's chart that I'll be able to review later. So I view that as a, as a big, big plus. So we can actually focus on being in a great relationship with our patients and not just treating them like teeth. I see medicine and dentistry coming together in big ways, as I mentioned before. Oral health is health. We know that a healthy mouth will lead to a healthy body and a healthy life. And so we're looking at connecting that in big ways too. So in the next 5 to 10 years, there's a lot that has to happen, but I see it happening.
Awesome.
I'll just add one other quick thing. Workforce is probably the second, if not the biggest challenge for a lot of people. And what, Brett talked about with AI, creating efficiencies in your practice, not having to have as many actual staff people to run your practice is a practical application of a lot of the things that are being developed. It is exciting. We do, from the federal level, try to get money for new workforce programs also. And I think getting efficiencies where, we've looked at trying to maybe increase the types of things that assistants can do in the practice that, could help move efficiencies for preventative care especially. So just a few.
Awesome. Well, I don't want everybody to leave. We want to just remind you a few things before we end our discussion today. For all of our participants, first of all, thank you so much for spending your time with us today, whether you're a member of the ADA or simply interested in the future of dental health care. We want you to know that your voices do matter to us, and we hope that you felt that on this chat and in this discussion today. We hope today's discussion provided you with some clarity. We hope that it sparked new ideas for you and strengthened our collective commitment to supporting dental professionals worldwide. I want to remind you that the conversation does not end here. We want you to continue staying connected with us through all of ADA's social media channels and events to further explore the initiatives discussed today, staying updated on the latest developments in dentistry, whether we cross paths at the conference week coming up next week or at SmileCon, which is scheduled for October 17th through 19th. We want you to know that your voice does hold significance. And last but not least, on my note sheet, as our Ask Us Anything sessions with Drs. Linda Edgar and Dr. Brett Kessler comes to a close, we do want to again extend a very heartfelt thank you to everyone who was able to attend. Your engagement has truly made this really insightful and enriching. So Dr. Kessler and Dr. Edgar, I want to say also that we really appreciate your time and so much of the insights that you shared with both me and all of our attendees today. Your leadership and dedication, we want to remind you, is advancing dentistry. It's so inspiring, and we're so grateful to have the opportunity to have this dialogue with you. Oh, do you want to share your contact information really quickly?
Brett, send us your concerns, your suggestions, give us your positive suggestions. That's what we need. We need to hear, and especially if you're a non-member, we would love to hear from non-members, what we can help get you into the fold.
Yes.
Yeah.
And so your contact information will be shared. If you wanted to share it here, you can. If not, it will be at the link in our bio for more information on how to contact our ADA leaders. Dr. Kessler, did you want to say anything?
Yeah, please put my contact information in the link.
Yes.
I'd be happy to entertain either by cell phone or by email.
Okay, perfect.
Text, whatever, that's great. But just want to say one thing, as dentists, it's a hard profession, and take care of yourself. Take care of yourself. You are your most valuable asset. And we in organized dentistry, the ADA at all levels, have resources for anyone who, may experience challenges in life. And that's what we're all about. So thank you for this opportunity.
Thank you so much. So much dental love.
Coming on and spending part of your day with us. We appreciate it.
Yes, go team, go. Much love, sending all the millennial hearts. Okay, I see everybody putting some hearts in the chat. We are going to sign off of our conversation, and thank you so much for everybody who was able to be here with us today. Bye for now.
Bye. Thanks again.
Bye.